What you need to know about penile prosthesis for the treatment of erectile dysfunction. Erectile dysfunction is the inability to maintain an erection firm enough to have sexual intercourse. It's incredibly common. 1 in 5 American men have ED, which means over 30 million American men and over 150 million men worldwide. 90% of the causes are physical and 10% are psychogenic. Having erectile dysfunction can have a profound effect on a man's life. It can affect his physical functioning, his social functioning. It can cause limitation because of emotional health problems. It can affect his vitality, his general perception of his overall health, bodily pain, and his mental health. Fortunately, there are a lot of excellent treatments for erectile dysfunction, including pills, vacuum pumps, injections in the penis, suppositories in the tip of the penis, and a penile implant or prosthesis. Oral medications are not effective in at least 30% of cases. These medicines only work in response to sexual stimulation. Oral medication must be taken at least a half an hour to 1 hour before sexual activity, and side effects can include headache, nasal stuffiness, facial flushing, muscle aches, and vision or hearing changes. You cannot use these medicines with nitrates that patients take for chest pain. Precautions must also be used with medicines for prostate problems or if you have serious liver or kidney problems. Another medicine that is used for erectile dysfunction is a urethral suppository called Muse. Small medicated pellets are placed in the tip of the penis opening that will help blood vessels increase blood flow to the penis. Advantage is that there are no needles or injections, and the erection can occur after 10 to 15 minutes of use. Some disadvantages include penile pain and burning, inadequate penile rigidity. The medicine must be kept refrigerated. The cost is about $25 per application, and sometimes patients with poor manual dexterity or vision may have difficulty placing the pellet. Another option is the vacuum erection device. The advantages are that it's non-invasive, it's drug-free, and it's cost-effective. The disadvantages are that it sometimes creates not as natural an erection as a patient is used to. It can be cumbersome, the erection is not warm to the touch, patients can experience some bruising, penile discomfort, and even numbness with the vacuum erection device. Patients will also report sometimes a delayed ejaculation or orgasm. Penile injection therapy is another option for the treatment of erectile dysfunction. It's a highly effective treatment, and the erection usually occurs within 5 to 20 minutes of injection. One of the risks is an erection lasting more than 4 hours or priapism. Patients can experience a small amount of bleeding at the injection site or discomfort at the injection site. It's important that patients receive training on how to do the injection, but over the course of time, patients can experience scarring that can lead to Peyronie's disease. Patients do notice poor long-term tolerability to injection therapy, and some patients are fearful of sticking a needle inside the penis. In terms of treatment, penile implant has the greatest amount of patient satisfaction as compared to penile injection or oral medicine, with over 90% of patients being satisfied following the placement of penile implant. 92% of patients would recommend a penile implant to other patients, and 90% of partners would recommend this. There are a few different types of penile prosthesis available: a one-piece non-inflatable implant, a two-piece inflatable implant, and a three-piece inflatable implant. Your surgeon will talk to you about which is best for you. The three-piece inflatable penile prosthesis has 3 different parts. The reservoir holds the fluid for the device, and this is sterile salt water. The cylinders will then expand in the erection chamber to give the erection. And then there's a pump that's located in the scrotum that the patient will squeeze to inflate and deflate the device. Penile prosthesis offers a great long-term solution to the treatment of erectile dysfunction. It provides the patient the ability to have an erection at any time. It allows for great spontaneity and enables the patient to maintain an erection for as long as desired. A penile prosthesis eliminates the need for costly pills or shots, and it's a very natural feeling during intercourse. Penile prosthesis does not interfere with ejaculation or orgasm. The risks of the procedure include infection, bleeding, injury to the urethra, swelling, a malfunction of the implant, a mechanical failure that may require replacement, erosion of the device, numbness of the skin of the penis or scrotum, or difficulty urinating. It's important to know that a penile prosthesis is not a penile enlarging procedure. Penile implant will not make your penis bigger. In fact, the penis may appear slightly shorter as the cylinders must fit inside the erection chamber. We advise for a good estimate of penile size after the implant, the stretched length of your penis will be about what you should expect. Penile implants are usually covered by insurance or Medicare. We will schedule the surgery and submit for the pre-authorization. Our staff will notify you of any monetary obligation that you have in regard to the surgery. There may be other expenses, including anesthesia or hospital bills, if the procedure is performed in a hospital. It's important to talk to your sexual partner about your decision. You should carefully consider the risks and potential benefits of this decision to proceed with surgery. Penile prosthesis is ideal for men who have failed other therapies and would still like to participate in an active sex life. Once you make your decision, we will coordinate scheduling your surgery. We'll perform pre-authorization with your insurance company and provide you with an estimate of any expected uncovered cost. Many of these procedures will be done in an ambulatory surgery center in your area. Some patients may require the surgery to be done in the hospital for medical reasons. You will need someone to drive you to the surgery and stay for the procedure and recovery. Prior to the procedure, it will be important to obtain a history and physical exam as well as blood work by your primary care physician. Most patients will need to stop aspirin and blood thinners roughly 1 week prior to the procedure. It's important to never stop these medicines without first discussing this with your primary care doctor. On the day of surgery, you will need to arrive to the surgical suite at the designated time, which is usually 1 hour prior to the scheduled procedure. The nursing staff will greet you and prepare you for surgery by placing an IV and starting your antibiotics. You'll then meet your anesthesiologist who will discuss which type of anesthesia will be used for your surgery as well as the potential side effects. They will also obtain a consent from you. You will also meet with your surgeon who will likewise obtain a surgical consent. You should urinate just prior to going into the operating room, and the surgery will take about 45 to 90 minutes. You should expect to be in the recovery room for 1 to 2 hours following. In the operating room, you will receive antibiotics, you will have anesthesia, and you may have a catheter placed inside the penis to drain the bladder, but this will be done after you're asleep. The surgery involves preparing the skin, placing the Foley catheter to drain the bladder, and then depending upon the surgeon's approach, an incision will be made at the base of the scrotum or at the base of the penis. The implant will then be placed in the hollow spaces of the penis and the scrotum will then be closed. You'll probably have a small drain placed in the surgical area to drain any unwanted fluid collections. You'll then be taken to the recovery area until you're fully awake. The location of the infrapubic incision is at the lower abdomen just above the penis. The location of the penoscrotal incision is at the junction of the penis and the scrotum. Both incisions will be closed with dissolvable suture. Some doctors will leave a catheter in overnight to drain the bladder. Having a catheter is no fun. It's often uncomfortable and make you feel like you constantly have to urinate. But fortunately, this should be removed the day after the surgery. Many physicians will leave a small drain at the time of surgery. These will need to be emptied every 4 to 6 hours and volume recorded. Usually the drains are removed 1 to 2 days after the surgery. The nurses in the recovery room will help wake you up after your surgery. When they do, they'll give you something to eat or drink and make sure that your pain is under good control. They'll go over your post-operative instructions and how to care for your Foley catheter and empty your drain. They will review with you your discharge medications and review all the surgeon's discharge instructions with you and your family member. When you are discharged, your doctor may prescribe antibiotics for a few days, a pain medication, and a stool softener because the pain medications may make you constipated. After surgery, you'll be told to stay at home for 5 to 7 days. It's important to take it easy and not drive. You don't need to be on strict bed rest during this time, but rest is important, and it's important to remember to exercise your calf muscles regularly. If your surgeon recommends using ice, you are to diligently place ice packs on the penis for 48 hours, 20 minutes on and 20 minutes off. It's important to try to make sure the ice stays in place while you're resting. One good trick is to wear 2 pairs of supporting underwear and place the ice pack in between. You'll usually return to your doctor's office 24 to 48 hours later to have your drain removed and the catheter removed if one was placed. You may eat and drink normally following surgery and shower on postoperative day number 2 or 3. You'll see your doctor back at 7 to 14 days as well. Another appointment will be scheduled roughly 4 weeks later to help go over the use of the implant. Your doctor will tell you when it is safe to start using it. Most patients will return to work after 1 to 3 weeks after surgery, depending upon surgeon preference. It's important to call your doctor if you experience a fever greater than 101.5, if you have chills, if you notice drainage from the wound, redness of the wound, if you're having pain that's not adequately controlled by pain medication, or constipation despite the use of stool softeners. Erectile dysfunction has been linked to cigarette smoking. Your risk of worsening erectile dysfunction is much higher if you continue to smoke, so it's extremely important that you stop smoking. If you need help stopping smoking, there are medications, nicotine replacements, psychotherapy, and hypnosis as options to help you stop. Please discuss these with your urologist as well as your primary care physician. If you decide to undergo placement of a penile implant, we hope that your procedure goes well. We sincerely appreciate your feedback regarding your procedure because we are always trying to improve the care that we provide our patients. If you should have any questions regarding your procedure, please contact your doctor. Thank you.